Welcome to Hit Show, your go-to source for today's leading healthcare business headlines. I'm your host, Ida Klein. It's Tuesday, September 30th. On today's Hit Show, Hospital-at-Home Authority could vanish at midnight without congressional action. Two very different provider stories, one about financial strain, the other about bold expansion. A data partnership in the South aims to speed research. Privia Health makes a $100 million play for ACO scale, and we'll end with a bright spot from Brown University's new RNA Center. Let's dive in. The clock is ticking for hospital-at-home and RPM programs. Logan, what's the latest?
CMS has told hospitals they must either discharge or readmit hospital-at-home patients by midnight tonight if Congress doesn't act. The waiver authority that's allowed expanded telehealth access, including hospital-at-home programs since the pandemic, is set to expire tomorrow on October 1st. Thousands of Medicaid and Medicare beneficiaries are affected. Hospitals are scrambling to manage last-minute transitions, and it's disruptive to uproot care teams and patients with almost no warning. And this all collides with a looming government shutdown. Lawmakers are still far apart. Becker's Hospital Review put it bluntly: very large differences remain. Without a budget deal, Congress may not even have time to extend these waivers.
Now help us understand, Logan. What kinds of services are actually impacted here?
Good question, Ida. Hospital-at-Home covers acute conditions like heart failure, pneumonia, COPD, even post-surgical recovery. Patients can get daily nurse visits, remote physician check-ins, continuous monitoring, lab draws in the home, even oxygen therapy, and pharmacy deliveries, and it's so much more. Telehealth services including pretty much any sort of audio only, and video telehealth visits, remote patient monitoring tracking vitals or other metrics with devices at home. Plus, virtual supervision and telepresence are included in the waiver. All of that only works because CMS reimburses under the waiver. Once it lapses, hospitals can't bill for those services, and the program's effectively shut down.
This is going to be really tough on people. Logan, what are folks going to do?
Some patients will be sent back into hospitals that may already be stretched thin for beds. Others may face abrupt discharges to home without the same support. Families will be left scrambling with very little guidance. Clinicians say it shatters continuity of care just when extended telehealth benefits and hospital-at-home services were proving their value.
It's a sobering moment, Logan. This has an obviously huge impact on providers as these programs that proved they could keep people safe at home are suddenly on the line. And it's patients and families who feel the impact first. We'll keep watching what happens in Washington, and we'll be reporting the latest news. Teresa, two very different provider headlines caught our attention.
That's right, Ida. First, Trinity Health reported a $1.3 billion net gain for fiscal year 2025, but here's the catch: that came despite an operating loss. Investment income covered the gap, underscoring how fragile hospital operations remain even for large health systems. Trinity executives stressed that their clinical operations are still under pressure from labor costs, payer mix challenges, and flat reimbursement, meaning that one bad year on Wall Street could swing their results dramatically. Meanwhile, in Tennessee, Memphis-based Regional One Health is moving forward with a $1 billion hospital project. Leaders say it's essential for long-term growth, even as labor and supply costs keep rising. Supporters argue the project will expand access to advanced specialty care in a fast-growing part of the state, while critics question whether the debt burden will weigh down the system if economic conditions worsen.
So, Teresa, it's a tale of two strategies: belt tightening on one side, big infrastructure bets on the other.
Exactly. And it shows just how uneven the provider landscape is right now.
We'll take a short break. But coming up, a new partnership in the South is opening fresh pathways for real-world data. We'll hear from Tanner Health's Greg Schulenberg. And later, Privia makes a $100 million play in value-based care. Plus, we'll close today's show with a bright spot from Brown University. Stay with us.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
You're listening to Hit Show. A new partnership in the South is reshaping how health systems and researchers tap into real-world data. Nate Collier has the story.
Briya, a health technology company focused on unlocking secure access to real-world data, has teamed up with Tanner Health, a nonprofit system serving West Georgia and East Alabama, to launch the Briya Tanner Network. The collaboration combines Briya's AI-powered platform with Tanner's extensive patient population, more than 3 million encounters each year across 5 hospitals. The goal is to give clinicians and researchers a secure and privacy-compliant way to extract targeted insights from health data that has traditionally been locked away. Tanner's Chief Administrative and Information Officer, Greg Schulenberg, told me the partnership turns dormant data into a powerful tool for innovation.
We engaged with Briya to figure out ways to query, identify, de-identify this data, but most importantly, to securely do it. And to do that securely, we do it behind our firewall, and then using their platform, which is powered by natural language learning, we can query that data to target it instead of just sending large chunks of data out to the ether.
Schulenberg added that the platform has already proven its value in early testing.
We've been testing all of the algorithms and the science behind it, and it is a really, really innovative and quite honestly one of a kind out there as far as we have seen. So we're super excited about the partnership. We look forward to offering data sets that can help other institutions.
Tanner says the project not only supports medical research, but also strengthens its ability to monetize data responsibly while improving patient outcomes in its own communities.
A regional health system opening its data vaults securely could accelerate clinical innovation far beyond Georgia and Alabama, and Tanner believes this is just the beginning. Anika, there's been a pretty big shakeup in the value-based care space. What's going on?
That's right, Ida. Privia Health is acquiring Evolent Health's ACO business for $100 million. The deal transfers about 120,000 Medicare Shared Savings Program lives and immediately extends Privia's footprint into 11 more.
So Privia's growing its national reach, but what's driving Evolent to sell?
It's a strategic pivot, Ida. Evolent is narrowing its focus to specialty condition management, things like oncology, cardiology, and complex chronic care. They believe that's where they can deliver the most differentiated results, while leaving the broader ACO market to players like Privia.
And what does this mean for the broader market?
Well, analysts point out the Medicare ACO space has become crowded and margins are thin. Scale really matters if you're going to compete. Privia sees this as a chance to double down on breadth and population coverage. Evolent, on the other hand, is betting depth will pay off by managing some of the most expensive conditions with more intensive, targeted programs.
So in short, one company is chasing size and the other is chasing specialization.
Exactly. It's a portfolio reshaping in real time, and it tells you a lot about where the value-based care market is headed.
Jade, let's close today on a brighter note. I understand there's big news out of Brown University.
Yes, Ida. Brown has announced the creation of the Giuliani RNA Center, named in recognition of a major philanthropic gift from Giuliani and Sabrina Giuliani, who are parents of a Brown student. The gift is designed to accelerate discovery in the fast-moving field of RNA science.
RNA research has been in the spotlight since the pandemic. What will this new center actually do?
The center will serve as a hub for both basic and applied science. Researchers plan to focus on how RNA shapes cellular function and how it can be engineered into new therapies and vaccines. It will also anchor Brown's role in the Human RNome Project, which is essentially an RNA counterpart to the Human Genome Project aimed at mapping RNA's full complexity.
So this could reach beyond academia into real healthcare impact.
By advancing RNA-based therapies, the center has the potential to transform treatment for cancer, rare diseases, and infectious conditions. And it gives Rhode Island's academic medical community a much higher profile on the national stage.
And what does this mean for other providers, especially academic medical centers?
Ida, it sets a bar. Other academic centers are likely to see this as a call to strengthen their own translational research, not just publishing papers, but connecting discoveries to real patient care. Gifts like this one also remind health systems how critical philanthropy can be for sustaining cutting-edge science.
I see. A real win for Brown, and a hopeful way to wrap up today's show. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you. Kimchi.com.